I'm Alexa. Today we're here with Megan and we're going to interview her about her nursing. So what is your job title here and how long have you been here at KC?
I am an assistant nursing professor and I've been here for 3 years.
Oh, what type of skills or personal traits do you think are necessary in this type of career?
You know, nursing encompasses a lot of different traits from a lot of different people, but personally, I think that, we take care of a lot of different patients and we meet a lot of people. And so having empathy for them and listening to them, having that teamwork with one another is really important. There's a video that talks about all these personalities that are super important for whether it be a career, whether it be going into finding your degree. And it's really about not necessarily giving the answers and finding what you should be, but what are you? How are you going to fit into this role? We don't want you to change your personality. We want you to be able to really love what you do and use your strengths and your personalities to better create a better environment, as well as, help take care of your patients appropriately.
What type of education or training is needed for someone looking to go into this career?
So we have so many different options in the nursing world. We have, students in a program here for CNAs or certified nursing assistants. We have LPNs or licensed practical nurses. We have RNs, so a registered nurse. And then, we have collaborations with other schools to help with your bachelor's and to further your education. So there are so many different ways and different aspects of nursing. And so it kind of depends on what you're looking for. And none of what we do would be available if we didn't have those other portions of nurses. So, being a nurse and being in the positions that I've been in, I've worked with CNAs, I've worked with LPNs, I've worked with master's prepared nurses who are still on the floor. And it's just great seeing the teamwork between all of them, because once everybody's together, once everybody knows each other's role, then it's so much easier and we provide such great patient care because we are all utilizing our different strengths and weaknesses with each other to help, really conquer all those aspects of patient care in order to create a great environment for that patient.
What are some of the biggest challenges that you faced in your job?
Knowing that I can't fix everything. So with patients, I come from the pediatric oncology world, and so naturally we have lots of emotions on that floor, and it's hard knowing that, two people can have the same diagnosis, but one may relapse and one may be cured. And so knowing that I don't have the capability to fix them all, and as nurses, no matter what patient diagnosis that there is, we do our best, we work with our resources, we provide the best patient care, but no outcome is promised. And I think that's the biggest challenge that I've had to overcome as being a nurse.
Why should someone choose KC to start their road in education?
So Kaskaskia College has a great small town effect and feeling over the entire college. We, have small classes. We bring great hands-on activities with our students, especially in the nursing world. We have small clinical groups, which can be more one-on-one with your instructor. And I truly think that the instructors in the nursing building, and of course everywhere in Kaskaskia College, is, we're all here to ensure your success. We want, we have office hours. We talk to you one-on-one, especially in clinical settings, because we have that one-on-one time with each other. And so I think it's really great to, provide feedback for students and help them realize their strengths and weaknesses in order to help them gain confidence and skills that they need to enter the workforce.
What is the most valuable lesson that you've learned in your job?
That nothing compares to a great team. We, coming from the clinical setting, like I talked about earlier, you have your CNAs, you have your nurses, you have your physicians and therapists. We have all of these different roles that help our patients achieve the best possible outcome we can give them. And same thing with, in the educator portion in the role, in that all of these educators work together. We are all each other's second ears, second eyes on things. if a student is having trouble understanding this concept, well, let me talk to somebody else and see if I can offer another way of understanding this if I can't do it myself. And so really, in the clinical setting, we're always looking at the patient's best outcome. In the educator setting, we're all looking for the student's best outcome. And ultimately, in the nursing world, we want you to graduate, we want you to pass NCLEX, and we want to see you out on that floor. And we want to say to ourselves, I would be very honored and thrilled for you to take care of me if I ever ended up in the hospital, or my loved ones for that matter. And so, we try and give all those skills and knowledge and attitudes to you in order to help you be successful in your career.
Thank you so much, Megan, for joining us today.
Absolutely. Thank you for having me.